Hi everybody, I am Dr. Rajesh TR, cardiothoracic and vascular surgeon. Lifestyle has changed over the last few decades, so has the problem with the heart. Nowadays we have a lot of patients who develop heart disease. All these years India was known as the diabetes capital of the world. Now it is being slowly called the heart disease capital of the world. Whenever we talk of any program, whenever we do any program about the heart and the diseases, it is always we start with all negatives, like how the heart diseases have become so common and how it has become a pandemic and epidemic and things like that. But I want to do this talk on a bright note. It is possible to prevent heart diseases. What one requires is the knowledge and will to understand and take the necessary steps to achieve this. Today I will help overcome many of the fears and misconceptions associated with heart surgeries. I am waiting for your questions. Oh, here is the first question. It's a very valid question they're asking. Generally when anybody is advised any surgery, they are afraid of it. Heart being such a vital organ, it is difficult for people to accept that there is something wrong with the heart and that it requires something like an operation to set it right. Fear is definitely valid, but it should not become a phobia. It should not come in the way of taking the rightful decision. There are lots of misconceptions associated with heart surgery. Today, heart surgery has become very common and it is being done in all the cities and places, even tier 2, tier 3 cities. But still there are a lot of fears and misconceptions associated with it. Commonly they think a vital organ like the heart cannot be operated upon, and that it may not withstand the surgery. They think they may not be able to lead a normal life after heart operation, or that they may not be able to earn a livelihood after the operation. And many of them think they're either too young or too old for the heart operations. We have quite a lot of patients who are educated also, who try to postpone heart surgery and resort to other methods to avoid the surgeries. And so many times these other methods are non-scientific methods. Yeah, here is another a very valid question. Who needs a heart operation? See, not every person with a heart disease needs heart operation. Majority of them can be managed with the medications and they find relief with that. Some patients need additional non-surgical methods like stenting or valvuloplasties, like so many of you might have heard of these things. But there are a set of patients in whom the medications do not provide full relief. And also these patients are not suitable for undergoing the non-operative treatments. These are the patients who need the heart operations and they will fully benefit from it. Age is definitely not a factor for considering heart operation. It is just in the mind. Today we have a lot of young active individuals who develop heart disease and who need heart surgery. The common response they have when I advise surgery to them is, "Doctor, I am so young. I'm still earning. I have a family, I have small kids, I have to take care of them. This is not the age for operation." But in fact, these are the very reasons why the operation is indicated in such persons. These patients need to lead an active life, and for that they have to overcome the heart disease and get their heart back on track. And surgery achieves this. We also have patients at the other end of the spectrum, the patients who call themselves old. These are the patients who have completed their family responsibilities and they're retired and they don't want surgery. They say, "See, I have finished all my responsibilities, I'm leading a retired life, I don't want the surgery." You are retired from your profession. You might have completed your family social responsibilities, but it is not the end of life, isn't it? See, if you do not undergo the surgery that is indicated, you will continue to have problems. And medications won't give you much relief. Gradually what happens, the physical activity goes down and you will start becoming dependent on others. Your quality of life suffers. Today we have nuclear families. In fact, even children are sometimes away in other countries looking after their own lives. If you have to lead an active, independent life, you need to be fit. And cardiac surgery ensures that you are fit to achieve this. Now, definitely it is not safe to put off heart surgery. It has to be done at the right time. Only then the full benefit of surgery is obtained. See, if you put off heart surgery, see, the heart surgery has been indicated in the first place because you are not getting relief from medications. So if you put off heart surgery, it means that you continue to have the problems. Gradually your quality of life suffers, gradually the heart function comes down, and it also starts affecting the other parts of the body. So many times we have patients who have delayed and come late to us at a time when they are no longer able to tolerate their problems. They come to us. Even in such stages, we are still able to do the surgery. However, these patients don't get the full benefit of surgery. Also, the risks in them are higher because they not only have the heart function that has come down, they also have problems with other organs, like for example additional kidney problems or lung problems. Also, in these patients the recovery is slow. These are in fact the very patients who discredit heart surgery because they have not been fully benefited from it. Yeah, see, it is really challenging to convince a patient because they are from varied backgrounds and varied intelligence and varied social and cultural beliefs. I tell them that, see, the heart surgery is a very standardized procedure. The outcomes are very excellent, and today after heart surgery you can get back to leading a normal life and continue to earn a livelihood. Most of the heart surgeries that are done today can be done with very low risks, that is just 2 to 3% risks. I do mention, like all surgeries, heart surgery is also associated with some risks. I do mention them to the patients, and I tell them I am mentioning these risks only so that you are aware of them. I tell them, do not focus on these risks. You focus on the benefits of the heart surgery. You see what you need to do to undergo the operation and prepare yourself physically and mentally for it. You know, if you have the right mindset and attitude, you can address any problems. This is true with any aspect of life. Yeah, when a patient comes to me for heart surgery, in addition to all the fears and misconceptions he has about the surgery, one question will always be in his mind: when can I go back to my life? When can I start earning? Well, see, the heart operation today is very well standardized, you know. The outcomes are excellent and it's a very safe procedure. It is all protocol driven. Most of the patients, we are able to get them off the ventilator on the same day. They stay in the ICU for a day or two, and by the next day they start to walk around, and by 4th or 5th day they are able to discharge most of the patients. And by the time they are discharged, they are independent and they can do all their works themselves. These patients can look forward to leading a normal life. In fact, once the heart problem has resolved, the heart becomes capable of withstanding the physical demands of the body. In fact, life becomes robust after a heart operation. See, by 3 to 4 weeks, they can go back to their work. We have, in fact, a lot of international patients, you know, who fly from all over the place, get operated, and by 10 to 14 days after cardiac surgery, they fly back. In fact, I had a patient who was a football player, amateur football player. After the heart operation, he went back to playing football after some time. See, as the incidence of heart diseases is increasing, we are seeing patients come with a very complex pattern of heart diseases. They are diffuse diseases, and they come in emergencies with heart attacks. They also have a lot of other problems. You know, it is quite common nowadays to see patients with additional diabetes, hypertension, obesity, high cholesterol, and even smoking. You know, many of the times we need to do these operations in an emergency. There is not much time to prepare the patient for the surgery. It's a very complex scenario and requires a very complex operation. Fortunately for us, in our hospital at Kaveri Hospital, we have a good skill set among the doctors and also a good amount of experience. We also have a good support from other medical specialties, which is a must in such patients. We do these complex operations routinely and with very good outcomes, and also with a very humane and personal touch. Yeah, the technological advancements have benefited all surgical departments, including cardiac surgery. As I said earlier, the procedures have become very standardized, the outcomes are excellent, and the risks involved are very less, and these procedures have become safe. This has been possible because of all the advancements we have had. It is allowing us to offer these procedures to a wider spectrum of patients, and so the benefits of surgery can be given to more patients. Also, we have newer supporting machines nowadays, like all of you might have heard, the ECMO, artificial heart, etc. These allow for us to operate even sicker patients, because these machines do the function of the heart and allow these sicker hearts to recover. Also, the techniques of cardiac surgery are evolving. We have what is called today the minimal invasive cardiac surgery. Here, using special equipment, we do the same cardiac operation through small holes or keyholes, either on the front of the chest or from the sides of the chest. Here, the recovery is faster, the discomforts are much lesser, and also the the incision is also quite cosmetic. As I said, the incidence of heart disease is increasing, so we have a lot of patients who come with heart failure, in whom we are not able to do the routine heart operations. In these patients, when they reach the terminal stages of the heart failure, there are other treatment options like heart transplantations and artificial heart implantations. Technological advancements, scientific advancements have allowed these also to be routinely done. At Kaveri Hospital, we have a set of experienced and skillful doctors across the specialties, and we are able to offer all these complex treatments, advanced treatments to all the patients. We are well equipped to do these procedures and get a good outcome. Definitely not. I think I have allayed a lot of fears and also cleared a lot of misconceptions about heart surgery. You should definitely not fear heart surgery. See, in fact, I will consider heart surgery to be a boon, not a bane. When somebody is advised heart surgery, he should make an attempt to talk to the surgeon and clear all his doubts. He should ask the surgeon what he and his family needs to do, how he has to prepare mentally for the procedure. He should look forward to leading a better life after heart surgery. As I began this talk, I said the heart diseases are increasing, but at the same time, the awareness of the problem and the treatment options available are also increasing. One should not be scared by the hard facts we keep quoting about heart diseases. One should be positive. They should look at the fact that there are advanced treatment options like heart surgeries and heart transplants and artificial hearts available, which helps us to help all the patients with heart problems. One should look at heart surgery as a boon, not a bane. I hope in this short time I have cleared much of the doubts and misconceptions, and I have tried to answer a lot of doubts patients have about heart surgeries. But if you have more doubts, if anybody in particular has been advised surgery and wants to discuss more, you're please welcome to drop down to Kaveri Hospital anytime and have a chat with our team. Thank you.